Hi everyone and welcome back. My name is Nikki Windsor and I am the Jungle Goddess. I am a culinary wellness coach specialising in digestive issues and in the connection between gut health, stress and anxiety. So last week I talked to you about bloating, and that was the first in a series about different digestive symptoms. And in the coming weeks I'm going to be discussing a number of other different symptoms with you. But before I delve more into the symptoms, I want to discuss the difference between acute digestive symptoms and chronic symptoms. So acute conditions are generally severe and sudden in onset. They often last only a short period of time, or in the region of days, maybe weeks. So that will be like diarrhoea brought on by a case of food poisoning. Chronic conditions are generally long developing and often slowly developing conditions that may worsen over an extended period of time, and that can run into months or even years. And this would be like digestive symptoms associated with a condition like Crohn's disease or IBS. So acute digestive symptoms are often caused by a viral or a bacterial infection. It could be a reaction to medication or a reaction to something that you're sensitive to or intolerant of. So that's usually something that you consume, like alcohol, dairy products or wheat. Stress and anxiety can also trigger symptoms. For example, if you're nervous about going to an interview. Chronic conditions tend to split into two different categories: functional conditions and structural. So functional diseases are those in which the digestive tract looks completely normal when examined, but it doesn't move or function properly. So constipation, irritable bowel syndrome, nausea, food poisoning, gas, bloating, GERD, acid reflux, and diarrhoea are all common examples. Now, these symptoms can be acute or chronic, depending on the root cause. Structural gastrointestinal diseases, however, are those where your bowel looks abnormal upon examination and it also doesn't function properly. So that will be strictures, hemorrhoids, diverticular disease, colon polyps, colon cancer, and inflammatory bowel disease. And these symptoms tend to be chronic. They tend to come on over a period of time. Now, I'm a culinary wellness coach, so that's where I'm looking at culinary medicine as forms of remedies alongside any prescription that you might have with a doctor. And now these culinary medicinal remedies that I recommend may very well relieve digestive symptoms, but their effectiveness will very much depend on the root cause of the condition. So for example, peppermint tea very well may ease abdominal cramps for an acute case of diarrhoea brought on by eating something that you're sensitive to. But it's facing quite the battle if the pain is associated with inflammation and ulceration of the bowel caused by Crohn's disease. So for all chronic symptoms, whether they're functional or structural in nature, you need to address the root cause of the problem. Now that may mean modifying diet and lifestyle to remove the triggers for a functional disease, or healing the gut first for a structural disease. Now, many people just tolerate chronic conditions such as bloating, diarrhoea and acid reflux. I mean, many have gone as far as they can with their doctor. They've tried solutions touted on the internet, and they finally reached the conclusion that there is nothing out there that can help. Now, I like to challenge this. I've been in that position, and I have brought myself out of it. You know, we are all individual, and digging into the root cause is the only real path to find a solution that is unique to you. So I encourage you not to give up, because we are all unique. We just need to find the unique solution that is going to work for you. So if you are struggling with chronic digestive symptoms and need help, then please do reach out. I can help you identify the root cause and guide you to restore healthy digestive function by optimizing your diet, nutrition, and lifestyle. So thanks for joining me today, and join me again next week when I'll be talking to you all about constipation. All right, have a great week. Bye.